Hello, my name is Stephanie Marshall, and today I'm going to discuss the Head Start Impact Study 2010's Executive Summary. I'm going to discuss the key evaluation elements exhibited in the study based on the things that we've learned in the course thus far, and discuss the strengths and weaknesses of the study, and conclude with defining the method of the evaluation and drawing conclusion about the evaluation as a whole. One of the key elements that I observed in the study was the identification of users and uses of the evaluation. The Head Start Impact Study states in the introduction that it was mandated by Congress in 1998 during the reauthorization of the program, and the purpose of the evaluation is for the Department of Health and Human Services to determine the impact of Head Start on the children it serves. It can also be inferred that the mandate from Congress was in response to either stakeholder dissatisfaction or, more likely, in order to answer program funding accountability. The Head Start program began in 1965, and it wasn't until 2000 that a study like this was published. The purpose or use of the evaluation is also stated in the introduction, and it states that the study's goal is to assess the impact of Head Start on the children it serves, specifically in the areas of school readiness and parental practices that support children's development, as well as determining under what circumstances Head Start achieves its greatest impact and on which children. Another key element present in this evaluation was defining program goals and relevant outcomes. The goal of Head Start since 1965 as part of the War on Poverty is to boost the school readiness of low-income children, and this is based on a whole child model including the areas of preschool education, medical, dental, and mental health care, nutritional services, and fostering positive parent-child relationships. It then outlined that the study is seeking whether there's a positive impact for Head Start participants in the areas of school readiness and parental practices, and goes on into great detail in each category using a control group. The categories that they used were 3 and 4-year-olds based on the year that they started, and the areas that they examined were cognitive development, social emotional development, health statuses and services, and positive parenting practices. Another area observed was the development of reasonable and appropriate evaluation questions. Identifying the desired outcome helps to lead to the formulation of program questions, and at the time of the congressional mandate, the advisory committee to the Head Start research development asked some specific questions, and these questions were: what difference does Head Start make to key outcomes of development and learning, in particular the multiple domains of school readiness for low-income children? What difference does Head Start make to parental practices that contribute to children's school readiness? And under what circumstances does Head Start achieve the greatest impact? What works for which children, and what Head Start services are mostly related to impact? The Head Start Impact Study provides specific impact results broken down by category as well as by the age and grade of the students, and identifies multiple areas of measure among the different age groups. So although the specific detailed questions are not outlined in this summary, I can infer that those questions were present. The final evaluation element, and perhaps the most important in my opinion, is the clear and meaningful communication of the evaluation findings. If the impacts were buried amongst too much extraneous information, or if they're not communicated clearly, then the intent of that evaluation will not be successful. The program change is unlikely to occur. So the specifics of the Head Start Impact Study were including 5,000 newly entering students in the Head Start program, ages 3 and 4, and it was amongst 84 agencies in the nation. They used a control group, which is basically students of the same demographic who are not enrolled in Head Start. The findings were that in early childhood, providing access to Head Start led to improvements in the quality of early childhood settings and the program that the children experienced in almost all areas across the board. The children in the Head Start group had a more positive experience than the control group in all of these areas in early childhood. After the first year of Head Start, for the 3 and 4-year-olds, there were positive correlations between the Head Start group in all areas, all of the 4 areas other than one, the exception being that in the 4-year-old group, that the social-emotional arena, there showed no significant difference between the control group. By the end of first grade, however, there were few significant differences found between the Head Start group and the control group. The ones found with positive impact were a couple, basically among the 4-year-olds regarding health insurance, and then the most significant finding was that among the 3-year-old group, there was a positive impact in the social-emotional outcomes. As discussed, there were several strengths, including defining the program goals, the identification of evaluation questions, clear communication of the findings. The charts were really user-friendly, so it made it easy to read, but there were some weaknesses. The weaknesses that I felt were present included the definition of the social problem. The report itself didn't get into the details regarding poverty itself and the linkage between the performance of the children in school and the relationships between their parents, the health care. The things that we can infer were present based on the goals of the program and the goals of the evaluation, but the specific conditions were not described. It didn't discuss the target population in this executive summary either, and so I don't know specifically what the low-income groups were, what the targets were. Again, we can make some inferences, but it wasn't lined out. It didn't explain what school readiness meant or what parental practices specifically meant, and there wasn't a clear examination of the program theory. The Head Start Impact Study was a summative evaluation and was also an impact study. There could be some elements of assessment of the program services and some of the program processes, but overall it was definitely an impact study. It was easy to understand and had several of the elements present that we've learned about in the course thus far. I think there could have been some clearer explanation of the social dynamics and of the social condition that brought the program forward, but overall it was a good first project in evaluation.